Hi everyone, Dr. Nemechek here. I want to talk about focusing on cholesterol for heart disease. I think it's a big problem. I think it's a mistake. I'm not saying it shouldn't be done, but there's this overemphasis on cholesterol. What's well established now, and has been for 20 years, is that cholesterol does not start heart disease, cardiovascular disease. The cholesterol does not start the process that's going to give you a stroke or a heart attack. All right? It's been very clear that the thing that starts that is inflammation, not cholesterol. Okay? But the pharmaceutical company has a drug that will lower the bad cholesterol, and they've been hammering away at this the entire time I've been a doctor. About 40 years. They've been telling this story because, if that LDL cholesterol's high, they've trained people like, oh, you just give them a drug, lower it, and you're good. And that is the furthest thing from the truth. All right? About half of the people who have a heart attack, their cholesterol is already at this low target where you're supposed to be safe. Okay? If it is the cause, how in the heck can that happen? And it's because it is not the cause. Inflammation is the cause. All right? Now, well, how do you know if you have inflammation? It's right in your cholesterol panel lab work. Everybody's looking at the LDL cholesterol. Okay? Your triglycerides are a marker of inflammation. If they're high, you got inflammation, and that inflammation might cause damage to your blood vessels that can ultimately lead to your stroke or your heart attack. If your HDL level is low, that's a marker of inflammation. If your HDL is really low, the inflammation that's causing that might lead to you having damaged blood vessels and ultimately having a stroke or a heart attack. You've got to focus on those two numbers. How do we change those numbers? You have to lower your inflammation. Now, one way, and it's not easy, is to lose weight. Body fat makes lots of inflammation. So very commonly, if people can lose just 10, 20 pounds, those numbers can change a lot. And if your HDL goes up and your triglycerides are coming down, you got less inflammation, and you have just directly altered the primary thing that's going to damage your blood vessels. All right? Other stuff, using the olive oil that I talk about to block the inflammatory nature of vegetable oils in the food supply. 2 tablespoons a day of extra virgin olive oil. Just pour it on your food. Heck, in Italy, they get 4 tablespoons a day. They don't even know they're doing it. So you can easily get 2 a day on your food. Dramatically lowers inflammation. That'll make your HDL go up and your triglycerides come down further. Adding some fish oil will make your HDL go up and your triglycerides come down even further. And then looking at your gut health. There's more papers now that are linking bacterial overgrowth, or what we call SIBO, which is where you have excess amounts of bacteria in the small intestine. And this overwhelms the small intestine, and material will leak into the body, triggering inflammation. That is also a cause of the inflammation that can affect your cardiovascular system. How do you deal with that? Well, ideally, there's a medicine called rifaximin. Twice a day for 10 days. It'll balance out the bacteria, and that will further raise your good cholesterol, lower the triglycerides, even lower your risk of heart disease even further. If they won't do that, you can use a prebiotic called inulin, I-N-U-L-I-N. And in adults, maybe somewhere half a teaspoon a day to a half a teaspoon twice a day at most. And this also helps balance your gut bacteria. It doesn't work as well as rifaximin, but it still will get you more along that path. So don't over-focus on the cholesterol values. Just because the doctor says, okay, oh, that's good. Look at your triglycerides. Look at your HDL number. If your triglycerides are high and the HDL is low, you're still at risk of having a heart attack. All right? That's all for today, everybody. Take care of yourselves.